welcome to one more episode of LAJA podcast. LAJA is India's first forum for women, and the podcast is done to support women at LAJA. Today we have Dr. Kalpa Shah with us. Welcome, Dr. Kalpa.
Thank you.
Tell us something about your work and you as well.
Yeah. So I'm Dr. Kalpa Shah and I am a homeopath and I am a Garbhsanskar counselor. I have been primarily working with women and children, and I have now 16 years of clinical experience working with them.
Brilliant, brilliant. What inspired to become a healthcare professional? I'm sure my viewers and I both are very interested to know that.
Yeah, so, and probably this is for the first time somebody has asked me this question. So as children we have role models, and when I was very small, my Masi is a gynecologist and she was our go-to person for smallest of smallest health issues or biggest of biggest emergencies. Like anything happens and my mom will give a call first to my Masi, then probably to my father or our doctor or further. So I was always in awe of my Masi, like wow, she's like a superhero. Every time we have any health concern, we go back to her. And then when I grew up, we had a family doctor, and I would deeply liked, the way he would advise people, the way he would educate the family. It was not just prescribing medicines, but he also believed in educating the family. So that's how I had this inclination. And least did I know that my father also wanted to be a doctor in his young days. And then when I chose this decision, he told that I didn't want to impose my dreams on you, but then he said, like, I'm going to live through your passion.
Brilliant.
That's how I chose to become a doctor.
Nice. That's a fantastic journey, and that's a fantastic inspiration also, I would say.
Yeah, so I feel like as early as maybe in 6th or 7th, I knew I'm just surely becoming a doctor. So I did take an aptitude test, but I said, chuck the aptitude test. I have decided and let me just go ahead on it.
Lovely. Lovely. What is your niche, Dr. Kalpa, as a health professional, and how do you focus on creating more segments within the niche that you have created?
Yeah, so I feel, as men and women, they have a lot of phases in their life. I mean, there is the childhood, then there is youth, then there is, they get adults, and then maybe they get senior citizens. But for women, it is not as simple. So women passes through multiple phases which are probably more than men. So a girl will have her puberty, then she will have her menarche, then when she gets married, she will have her preconception phase, then there is pregnancy, then there is postpartum phase, then there is menopause. And that's not just, over years. Every month a woman's life will change in 15 days. So first 15 days we call it as a follicular phase, and then we call it as a ovulation phase. So it's not like the large span that a woman keep changing, but every month the body changes so frequently. So that's how I realized that if a good healthcare support is provided to women, they will be able to transit easily through these different phases.
Absolutely.
So I don't stop going to school because I've got periods. I don't stop being a mother because I am pregnant, or I don't stop being a wife if I am in a menopause. I continue all these roles. So if healthcare can provide some support to these women, they'll have a better transition in these various roles. That's how I chose that this is the niche I really want to work on. And second niche that I want to work on is children. So I feel as children, if they are attended in very young age, so then their immunity is good, their milestones develop better, and in future they turn out into a healthy adults.
Brilliant.
So that's how I chose that, these are two segments that I want to really address and work on.
Lovely. How does homeopathy, while you're creating your niche and while you're working with children and women, how does homeopathy support in this journey of creating a healthy lifestyle?
Correct. So as everybody says, homeopathy is a holistic science. And maybe before jumping to that, let me tell you how other pathies work. So if a woman is suffering through any problem, whether it is a period related problem or if there is anything where she is not able to conceive, the only support that probably allopathic can provide you is giving you hormones. That your problem is because your hormones are not functioning optimally. So either they will give you hormones which will either support that phase, or which will help you neutralize the effect of unwanted hormone. So this is how that works, and I really respect, and it's a beautiful science. They have good calculations and everything. But where homeopathy differs is, homeopathy says that the body knows to do this function because of some probably physical, mental, emotional stress. Body has lost this capacity to perform this well.
Okay.
So what homeopathy does is, it will support the body to function back to normal. So I will probably not need those hormones, those medicines every day, but homeopathy will help your gland to take over its own function. So it's like, there is a child. I may do a particular task for a child today. I may do it again tomorrow, but the child is dependent on me.
Yes.
But if I teach the child to do the task,
you're equipping.
I am equipping. That's exactly how homeopathy works. Homeopathy says that body has its own intelligence. Only thing is, because of the stress or the kind of factors that we are into, it probably loses the track, and homeopathy will get it back. So it is the body's intelligence which is used to work when it is trying to cure.
Very nice.
And that's exactly how, when we are working with small children, or when we are working with women in these phases, that's exactly. So homeopathy is not something that will create dependence. Sometimes people say, like, should I stop the medicine that I've got my periods, or should I take this in pregnancy or no? I said absolutely it is safe, because it is encouraging your body intelligence, and your body knows it well. It's only when it encounters something which is unnatural, it probably sometimes will shake off and fail off. Our support is to just help it back to get back on track.
So it is not creating dependency, it is creating or equipping the patient.
Correct.
Very nice. You introduce yourself as a Garbhsanskar facilitator.
Yes.
What actually is Garbhsanskar, and would you like to talk about it?
Yeah. So initially, the age of education was 5 years. I would remember my father telling that, at 5 years I would have gone to a nursery, and then probably by the time when I was small, I would have gone to maybe by 2.5 years, and then maybe when I have my daughter, she went at 1.5 years, and maybe a few years after she was born, there was mother toddler, like 8 months.
Correct.
So I want to tell, let's not even stop there. So this is like minus 9 months at least. So Garbhsanskar is basically, your unborn child has unlimited potential. It is about you, how you can help this unborn child sharpen the potential or put the potential to effect. So that's basically Garbhsanskar, where it is physical, mental, emotional, spiritual training of mother and the unborn. So that, ultimately it's the fight of, nobody wants to be second. Everybody wants to be first, or everybody wants to do something that's extraordinary. Like, why ordinary? So that's the process of making this extraordinary child. And honestly, previously people had multiple children. So maybe, one of them did this, one of them did another, like somebody who was good in probably like strength did probably farming. Somebody who was good in managing took a managerial role. Somebody who was good in creativity took a specific role. Unfortunately, in today's generation, we just have one child, and we are loading the child with all this thing. And to my 15 years of knowledge, believe me, it's not loading. It's the child just discovers the potential that the child has.
Absolutely. And that has a lot to do with our mythology also. We have read in Mahabharata also that जो भी अभिमन्यु ने सीखा है वो कुंती के गर्भ से सीखा है. So that's how strong
and there
Garbhsanskar
were things
is.
like so many kalai of purush, so many kala of stree also was taught. So they also learned multiple things, but it was taught in Gurukulam, so it didn't look like they went to multiple classes. Now we have expert for all, so that's how your child goes to multiple classes.
Absolutely. What advice would you like to give to the couples who are planning a child?
So to the couples, I would like to say that pregnancy is not by chance. It is always a choice decision. But before coming to couples, I would like to first, address something to the women out there. That there is a song, Matlabi
हो जा जरा
matlabi. And I really want to tell every Mother's Day, when I'm called for any talks, I want to take my mother there. I want her to listen to this, that please look after yourself, please take care of yourself. You are not taking care of yourself doesn't make you the best mother in the world, doesn't make you the best wife in the world. You have to take care.
That's true.
So that's right, that it's a couple who is pregnant, like collectively now we call like we are pregnant, but the strain is actually borne by a female.
Mother. Correct.
So I feel definitely both of y'all have a equal role, like having proper lifestyle, having good diet corrections, having a good routine of sleep, having good work-life balance. As a couple, it is definitely required. But for women, I would lay stress more because it is 9 months that she has to carry this baby in her body. See, usually when I eat something, that food is used for wear and tear of my body.
Correct.
But when I'm pregnant, it is not just used for wear and tear of my body, but it is also used for creating a new human being, a new
And
organism.
supporting a human being.
Exactly. And a human being who is not yet able to live on its own.
Absolutely.
Imagine it's like, a child is on, when you see an adult is on ventilator, the child is dependent on you. So your body has to be ready for this pregnancy. And here by ready, I just don't mean like physically ready, like my nutritional levels are right.
That's
here
right.
also it means mentally being ready. Are you ready to have the role of to be mother? Forget being a mother after seeing a child. But to be mother, are you able to give that time to yourself to eat well, time to yourself to take a break? Are you able to give that time, me time? That's how you start preparing. So that's an advice, like be prepared. Let pregnancy or baby fall to you by a surprise.
I remember my dadi used to tell me, my grandmother, achar vichar vihar matters.
Absolutely.
When a lady is pregnant, and the mahol also matters.
Correct.
Right? Lovely. You have been conducting a lot of sessions on Garbhsanskar. You've been meeting a lot of 2B couples. You have been conducting a lot of sessions on Garbhsanskar. You have been meeting a lot of 2B parents. One impactful story where you feel you really made a difference.
Yeah, so maybe to start with, I would not exactly talk on say couples or 2B parents, but let me start with something. So there was a patient of mine, and it was a high risk pregnancy, and the child that came out was quite high risk, and the mother was very sensitive. So she would message me small things, and in the end she would like, hope I'm not bothering you, or I'm sorry, I'm taking your time. She would keep writing this, and I would wonder like why is she like feeling so much about it. And then once I messaged her and I told her that why do you come up with this comment every time in the end of our conversation? And she would tell me that, ma'am, you have multiple patients and probably you think of all of them, but for me it is just my one child. So when this one mother is put to ease, it is my victory. When I'm able to answer, when her child who has been like a 6-month-old child who is taking nebulizer frequently, a 1-year-old child who is having asthma problem and is every week put to nebulizer. So when that mother is able to sleep well, when that child is able to be off nebulizer, these are my small victories. And then secondly, definitely about the 2B couples, like people who have been struggling to conceive since long time. And then they will typically come up with one thing, that reports are normal, but we are not able to conceive. Everything is fine. Gynec calls it as an unidentified infertility. And that's when my role will come in, like, having the right mindset, being physically ready beyond the reports that you've got. So when that mother or when that couple sends me a positive UPT picture, that's my victory.
So small things makes huge differences.
Absolutely.
Rightly said.
Exactly. And in pregnancy also, see, generally we have this attitude that pregnancy is a disease state. Constantly people will advise, ye mat karo, wo mat karo, aise karo, waise karo. So the pregnant women is through a lot of stress. And of course, the maternal age has increased. So there are complications as well. So again, my role over there is giving them affirmations along with the medicines or medical line of treatment, but those affirmations will help them be like settled. And when they send me, ma'am, my sonography report is done and the baby is well now, or I've just covered up the weight, or the placenta is moved up, those are my small victories. And
Brilliant.
that is something that gives me strength to stand up next day and like, okay, I'm on it.
And that is so satisfactory as well, Dr.
Absolutely.
Kalpa. What is the plan of action for next 5 years, Dr. Kalpa?
So for the next 5 years, I feel that there is enough that is being done in Garbhsanskar, but I realize that either these mothers are new or there are too many roles that they are playing. So my next is to give them have that support group. A support group where I will support them in their initial newborn phase, where they're new moms. I will support them when their child is growing big, when they're introducing food to them. I would like to support them in the times of their milestones. So my first target is to set in places the support groups, something that tells them beyond the medical advice. A pediatrician might not have that much time to educate a mother. He will probably write the right prescriptions, but it still has, the mother in stress that will my child be okay, or is this okay, or is this not okay? So maybe my first target is to have this well post-pregnancy program where it looks like a post-pregnancy program, but it is a newborn or a child program, which I am looking forward to. That is first thing that is in my head. And second is preconception. So I've seen generally now people get married late.
Correct.
After getting married also, they don't really plan to have children soon. So because of this late maternal age, work factors, stress factors, they have a little difficulty in setting the mindset right when they want the baby.
That's true.
And when they, probably make a decision, the body is not in that capacity to help them. So my second focus is to help majorly this preconception couples with various workshops where they're able to envision them, having a baby, where they're able to face the challenges that they're having, and probably medically also support them in the disease, illness that they're having, like PCOD is common nowadays.
Absolutely.
Diabetes is common.
You get to hear it so often.
Correct. Cholesterol is common. And then they are concerned that this should not pass on to my next generation. So my role is basically helping them and making them so well equipped so that their pregnancy goes on smooth. And of course holding them back when they are playing their new roles of being parents.
Absolutely. So recently I happened to read that majority of the new couples are not wanting to have a child, and it's a conscious decision that they have been taking. But I also read that if you want to learn love, the true love, do have a child. Your child is going to teach you what true love is all about. Thank you, Dr. Kalpa. And if you are the couple who are intending to become parents, or if you are the ones who look forward to having a holistic lifestyle, you need to connect with Dr. Kalpa Shah. Thank you so much for being a part of today's podcast.
Thank you.
And I'll see you soon in another episode with yet another superwoman. Thank you so much.